All right. Good evening, everyone. Today is February 8th, and we're going to call to order the meeting of the East Long Meadow Board of Health. Um, the Board of Health is recording. Is anyone else recording? All right, no one else is recording. And we are meeting virtually via Zoom this evening pursuant to a March 2020 order by former Governor Baker rescinding certain provisions of the open meeting law, which was extended by Governor Healy. Um, so, any other announcements? Did I do them all, Tammy?
I have not heard whether or not we like need to change our sort of opening announcement or not. I think that
Right.
I
I have
don't
a
even know if
cute.
anybody's using them anymore, but I think it's
That's
extended
okay.
next year, right?
We'll just follow MGL and it'll be fine. So the first thing on the agenda is the minutes of the meeting from December 21st, 2023. Thank you, Renee, for the minutes. Does anybody have any changes or additions to the minutes? No? Okay.
I move to
In that case,
approve
I will
as
make a
written. Oh, you did it
Katie's
already.
gonna make a motion to accept the minutes as written. I can second that motion and we shall do a roll call vote. Christine Johnston, aye. Dr. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
All right. Is there anyone here for public comment this evening?
No, ma'am.
All right. Well, if no one's here for public comment, we are going to move on to business at hand. And Chris, we're so glad to have you tonight. So, Tammy, I'll turn it over to you.
Oh, well, I just figured I just said meet and greet with with Chris. Just to maybe Chris, you can kind of tell everybody a little bit about it's not an interview. You already got the job. Just tell everybody a little bit about yourself and your hopes and dreams for your position, I guess. I don't.
My hopes and dreams. Wow. This is a great community to work in. I grew up here. I never thought that I would be the public health nurse in town, but I am now, so that's really cool. Before that, I worked in the public school system. I worked in Springfield, Wilbraham, and East Long Meadow. So I have a little bit of public um, experience, but with the younger ones, not the more advanced age, and I'm really enjoying them. So I'm just welcome. I mean, I'm just excited to be on board. Thank you. That's
I
it.
know the people at the senior center are like very thrilled that you you are there. They have someone they've access. I'm no longer getting like the business from people who come into town hall to pay their bills saying, "Why don't you have a nurse?"
Ah,
I
good.
do, actually.
Yeah. Yeah.
I know you kind of like you kind of you came out running on the public health nurse side of it because like the day you showed up, I think we had some like latent TB, like the next week
Hmm.
some varicella.
Yeah. Yeah. No,
I
that's
was like,
true.
I'm like, it
Yeah.
was almost like the timing could not have been better that
Hmm.
you showed up when you did. And I have to say, Erin Kobler, that's how you say Erin's name, right?
I think so. Yeah.
Council on
Yeah.
Aging Director.
Hmm.
Like, she
Hmm.
has been so great to work with, like in this making this position that's part health department,
Hmm.
part
Hmm.
council on aging. And
Yeah.
I know she's just thrilled to be able to, I think we've always wanted this, like somebody to branch that area. And it's really
Hmm.
awesome that you're here.
Yeah. I love it. Thank you.
I guess
Thanks so
like
much for joining us tonight. Yeah, it's so great to have you on board. And if there's anything that we as a board can do to support you in your role, please don't hesitate because we're excited to have you here. I think I speak on behalf of everybody.
Well, thank you. I did learn as of today, I will be meeting with the chief of public health nurse in Massachusetts. I guess it's a new position, and she's going to be coming out to meet me March 12th at the
wow.
town hall. So that'll be pretty interesting to meet her. I guess she's going to put together if you will lack a better word, like a playbook for public health nurses, local public health nurses, and what, what's expected of them, what they should be doing, and different type of outreaches and contacts. So I'm looking forward to meeting her. So we'll see what happens.
Oh, that's
Yeah.
and do you know their name?
Oh, let me look it up. I have it somewhere.
That's okay if you don't.
It's in my email. I'm just looking at my phone. Hang on one second.
It's been very nice too. And
Caitlin. I should know. I should have remembered that. Her name is Caitlin, and she's coming from. Have you, Caitlin Pendegill? Does that ring a bell?
not at
No.
all.
She's coming from Wayland. Where's Wayland, Mass? Anybody know?
I think that's way out east, probably.
Yeah,
Is
that's
it?
way out of.
Oop, something happened. Sorry. Sorry about that. Yeah, Caitlin Pendegill. She is a DPN RN, Chief Local Public Health Nurse. So that's going to be pretty neat to meet her.
It's with the public health standards that came out in October. I
Mhm.
think one of the things that one of the gaps that was identified from it is that public health nursing doesn't have a sort of set of standards that everybody goes by, and
Yeah.
there's not as much like well, like for instance, Chris's training is I'm sending her to just basically every person I know. Like there's no set standard for training for public health
Mhm.
nurses, so it's really good that
Mhm.
the Office of Local Regional Health is starting to do this. And I heard about this position, but I didn't realize they had filled the chief position yet. So
Yeah.
to
Yeah.
be able to have conformity in both
Mhm.
how you work and your training is awesome.
Yeah. I agree.
But there is
Mhm.
like Hampden County has a really nice group of public health nurses for like people to rely on. Obviously, nobody else in the department is a nurse, so to be able to say,
Mhm.
"Hey, so and so from West Springfield or Longmeadow," how do you do
Yeah.
this?
I get to meet the rest of the girls in Western Mass area on Valentine's Day in Ludlow. They're having a meeting. So
Oh,
I'll be
awesome.
going to that. Yeah. Yeah. And I hear that they're a great resource, all of them. So that's
And
another
that's
thing to look forward to.
that's the Massachusetts Public Health Nurse Association, right?
Yes.
Yeah.
Yep. Yeah.
And they
Yep.
have like local chapters and stuff.
Mm-hmm. Mm-hmm.
Yay.
Yeah.
Very good.
Yeah.
And I know like you're getting certifications to do a lot of classes at the senior center, which is kind of cool.
I am now chair certified. I can teach advanced chair aerobic classes. So that'll be fun. I'm really looking forward to that. Yeah. Because I have a background in I used to teach aerobics years ago. And I was certified in aerobics, but that was, like I said, a long time ago. So it's just kind of getting back in there and doing it all over again. And it's something that I've always enjoyed doing. It's not work. It's like kind of a passion of mine to move my body around and help everybody else. Yeah, that'd be fun.
You'll probably get to meet some of my students. I'm over at Springfield College, and our special populations class in
Hmm.
exercise science usually goes over to the senior center periodically to work
Oh,
with some
yeah.
of our residents. So it's fun.
Yeah. Yeah. Hmm. In fact, they were over today. They did the sail class. Is that what it is? The sail? Yeah. Yeah. Yeah.
Oh, who's the intern from Springfield College that has been working quite regularly? I can't think of what her name is. Is it Caitlin? She was when we were there together, she was there. She's really
Okay.
gotten she's fantastic. She's been doing so
Hmm.
I think she started with doing nutrition there and now she's kind of
Hmm.
expanded. Yeah.
Yeah. There's a Kaylee there.
That's Kaylee. Maybe that's Kaylee.
Yeah.
Yeah.
Yeah. Yeah. She's adorable. Yeah.
Well,
Mhm.
and I know that they put a nice on Facebook, they put like a nice welcome and what days that you're doing like blood pressure checks and stuff.
Yeah,
I,
yeah, they
I
did.
put it on our health department page too, just so people can see.
Oh, okay, good. Oh, thank you. I already commented. I'm like, oh, thank you.
Go
A heart
back.
emoji.
Okay. Well, I mean, unless you guys have any other questions you have for Chris or okay. Chris, like feel free to stay on and just chit chat with us.
Okay,
Or have the rest of your evening.
okay. Thank you. Nice to meet you guys.
Thank
Bye.
Yeah.
I'll mute.
You don't have to. Um, let's see, health department updates. I think so. Like I was mentioning it, I feel like we're finally in this like space where we're not crunched for time this week, which is really nice. Uh Town reports in, budgets in, renewals for that already started going out, so we kind of figured all that stuff for a
I
lot of
renewed my dog license.
yeah. What did you do it online?
I did it online.
Was it easier the second time around? Like
Much easier. Yep, it was
because
great.
one same thing. Like once you're in the system, it's same thing as our
It's a
apartments.
really great system. Yep.
Yeah, I'm actually I know that they were talking about the deputy town manager and the town manager that there's some more MGM grants that are coming, and I think it would be fantastic if we could purchase more modules for this program. Maybe even they have a inspectional software module, which we have some, but it's not really great. It's clunky and it's like it doesn't pair up with our permits. So it's not they don't mesh. So it would be great if we could get another grant from MGM and add that one on to the module or maybe budget for 2026 or something like that. But it has been working really well. We're kind of and then the next step is like sort of our summer permits. Working on that like camps and let's see, I already did pools. Oh, body art. I think that's probably camps and body art. That's probably what's left. That was my goal for this year, getting everything else online. Let's see. I feel like Liz has been really busy lately. So I like sat down with her today and uh kind of got like the rundown on our recycling and trash program. She wanted to highlight that the town manager has signed and updated our new buy recycling and recycling policies for town. Basically putting a preference on recycled materials and making sure that we're recycling for all of our departments. Let's see. Uh, January is the time that she sends in all the information for our recycling grant that we receive every year, which is what funds her position. And because she was one of the first people to get her grant paperwork in, she is now in a raffle for free cupcakes. I just thought that was the cutest thing. A raffle for free cupcakes. Let's see. We are working with the library right now because we're trying to figure out some things to do with our recycling grant. And one of the things that we've decided to do is partner with the library on their library of things. And we met with them a couple weeks ago just to find out what they already have. And they do have a lot of stuff like sewing machines and microscopes and other things. And we were looking to maybe get a shed, but now that they put the e-charging stations out there, there's no room to put a shed for the library things. So one of the things we're going to try to help with storage cases so that when they're in travel, they don't get banged up and we don't have to buy new library of things products anytime soon. So we're going to try to help them on purchasing with our grant, help them purchasing the containers. They're also helping the library with some new recycling stations because the kids kind of make a bit of a mess at the library after school. So we've got they're putting in more recycling on the outside of the building and on the inside of the building. And speaking of more recycling and containers, Earth Day is planned for the kind of kickoff party event April 12th, and the actual pickup, the actual Earth Day cleanup will be April 13th. We don't have we don't have anything yet for what we're going to do with the April 12th besides picking up the bags. But we've been working with the library. We had a meeting with some of the people from the school trying to see if maybe we'll do another art exhibit. Maybe do some sort of, I think we're looking for like a recycled craft project too. So that more coming, you know, if we want to make a Board of Health team, if you ladies want to for Earth Day, you're more than welcome. You're always more than welcome to help us at the transfer station too, because the more hands, the merrier. We're also trying to get the community service program to be a little more hands-on with the program, because usually the students just show up and they're like, well, I don't have a paper, but my name is so and so. Can you just write my name down? It's like, we're elbow deep in dirty cans. Like, no, we can't. So we're trying to eliminate the need for that kind of thing on the day of the Earth Day event. And she's also Liz is also working on getting materials translated to kind of keep up with sort of like the equity portion of the grant, making sure that the information that we're putting out to the community is available in other languages. And the people that I've been working with they no longer have translation services. So if any of you have come across any organizations that provide it for low or free discount price, let me know.
Google Translate?
Well, I mean, I guess because there's no person to verify that it is.
I feel like Google Translate's very accurate, but in the
Yeah.
pinch, especially if you're trying to, but we use at the hospital, oh,
They
it's
do
not
have.
called Stratus. It's not Stratus. We use something else. It's another company, but they have it on iPads. And so that might be something to look into, because you're only charged by the minutes that you use the translator, and I think they have up to 60 different languages. And it's a live active interpreter.
Not Stratus?
Well, it was Stratus. So let me find out the name. Hold on. It'll come to me.
Or if there's specific languages you're looking for, I know like having it in as many languages as possible, but if there's some priority languages, certainly let us know because, you know, I have international students and all those kinds of wonderful resources.
Oh, that's a good idea too. That's what we had, the Academic Public Health Corps had been providing it, but this semester they don't have students available for translation services.
So it's called AMN, Healthcare Language Services. And we literally have an iPod on a little stand with a speaker, and you click whatever language you need, and you're only charged by the minute in addition to, I think, the fee for whatever it is for the year. But we use it at our community health centers as a way to make sure we have access to every language that we possibly need. And you can probably pick and choose based off of like what Christine was saying around, what are the specific languages you're running across that you might like, if it's Spanish or, we have someone who's Haitian Creole and, things like that. But I'm just thinking about the ones you use on a regular basis. That might be a way to kind of offset some of the in-person expenses if you were kind of having to worry about that.
I know on a county level, we're looking to purchase for the towns Pocket. It's a brand. It's like Pocket Translator, but I can't think of it. It's called Pocket something. With our public health emergency preparedness funds, which I think would kind of be interesting to have. Sounded like someone was trying to get in here. but I don't know how much you can rely on that. Like what how does it translate on written materials that or promotional materials? It could seem very dry or might not be the right kind of things. Sorry. Please go downstairs. Like, please, please go downstairs. Sorry. Let's see. That is trash. Let's see. We went over permits. That's been going pretty good. Let's see what else. Ladies, what else is going on in our office? Nothing.
Can't lose a new desk. I don't know.
Oh. We now have enough desks for all of the people who work in our department. That's so nice. And chairs as well.
And cheers. Tammy, when I went to visit Ashley yesterday at the Long Meadow Senior Center, they had a Sharps kiosk. It's right in the front of the building, which I was kind of surprised, but it reminded me, I did a double take. I looked at it and it looked like one of those big red boxes that you could rent your movies from.
Yeah.
But it's the Sharps one. And I've been asked from a few seniors over at the senior center if we would get a Sharps container. And then I had talked to Erin about my meeting with Ashley, and I told her about this big Sharps container, and she gave me a name of the company and a contact person on how to obtain one of those. So I didn't know if that would be something that we could look into. And Erin even said that she wouldn't mind having it placed maybe somewhere outside of like the back part of the senior center. So I don't know whose budget money that would come out of or whatever, but I just wanted to, while it was on my mind, I just wanted to mention that to you and see what you
No,
thought.
I would love to know who provides the kiosk, because we have been trying to we use a state contract to use
Mhm.
for Stericycle, but
Mhm.
even though on the state contract it says that they do provide kiosks, they don't anymore.
Ah, mhm.
So there's nobody on that list that, and I
Mhm.
had called down them that actually you can buy the kiosk itself. So it would be great to find out who they use to
Okay.
purchase it.
Yeah, I have the contact. I just don't have it with me right this moment. It's in my
No,
pocketbook, I think. But
at work.
I was gonna say something and now I forgot.
I'd
But I
like to
mean,
put one, yeah, I'd like to put one
yeah.
like in that foyer outside in town hall. I
Oh,
think
that's a good idea.
that
Yeah.
would be a nice spot for it.
And it's just safe for all of us, you won't be actually taking a container from a person. They'd have to just deposit it themselves, which is much safer,
And
you know.
I think the idea of having it there and the foyer provides a little bit of like privacy.
That's true too. Yeah.
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 Just in case,
So,
some people don't really want you to
mhm,
do business. So
right.
I don't blame
Yeah,
them.
that's
Yep.
true.
You have to let
Yeah,
me know who she uses.
I will. I
Yeah.
will. Thanks.
Oh, perfect. Look at that. See?
Yeah.
Let's see. Other updates. Well, I can just so every year or about a week or two after the budgets are due, the town report is due, or the department reports are due for the town report. And I felt like this year there was some sort of interesting once I started adding up things like permits and stuff like that, there was some just interesting things about kind of what we did in 2023. Um, we've already talked about this, as everybody knows. We went, let's see, in 2023, we went live with 9 different types of permits on OpenGov. But at the same time, in the beginning of the year, if you remember, we kind of voted to consolidate some of our permits whereas we had a couple different types of food service. I just felt that it would be easier that we had one. And I thought, we're going to have less permits this year because of it. And that's not the case, because I think the total for permits last year was something like 177, or for 2022. And then once I started adding up all the permits we issued in 2023, it was 266, which is significantly more. So I feel like even though we cut down on the types of permits we had, I felt like with OpenGov, we had a lot more follow through with people for actually applying to permits, especially the temporary online permit. I think that once that people started to, just like the dog permit, once they filled out one, temporary permit for event, they were more likely to pay for the next one. So that was kind of like a good thing. I feel like that we got out of the permitting module. I don't have numbers for how much we made in the year, but it's probably very similar, seeing as those permits were a little lower, that we went up a number, but we went down on the ones that are a little bit more expensive. Let's see, we kept pretty steady for food inspections in 2023, even though Alex was out for for 3 months. I think maybe we went down like 15 food inspections in that period, but I know she's definitely been making up for it. Let's see, we responded to 39 housing and code enforcement complaints, with 34 of them being valid, and having to go to court 3 times in 2023. And those 3 times were in regards to one condemnation, but that condemnation occurred, I believe, in 2019. And it has ended up in an order for receivership of the property. Let's see, 5 pools, no pools were shut down, and 6 camps, and no camps were shut down, which is really nice. Let's see, in 2023, we also saw reduction in our trash, municipal solid waste, of 8.26%, which is actually quite a bit, which meant that we, let's see, we were over 4,000 tons, and now we're at 3,773 tons of trash for that last year. And I guess there's some of it, as we instituted the organic waste program, so that meant our buildings in town, our schools and our senior centers, are throwing out less solid waste because we're composting. And I also think it's a good, it shows that, Liz has been doing a really good job working with the businesses on making sure that they're recycling in town as well, and the residents. Let's see, we went up, let's see, to 736 tons of paper were recycled by our residents, and 651 tons of containers were recycled. 470 mattresses. Whenever we get the bill for the mattresses, I'm always like shocked. Like, I didn't realize people went through mattresses so much. And
you're actually supposed to throw away your mattress, I think, like every 8 years. I feel like no one does that though.
Based off of the numbers, I think people do here in East Long Meadow. Let's see. Yeah, so the total for this year for food waste that we composted with our program was 35,653 pounds of food, which is pretty cool. And one of the things we sat down with Casella earlier this month to maybe kind of come up with some options for either curbside compost collection, or there are these little in-house countertop bio digesters. I haven't seen much about it, but those could be some options. We just have to figure out like maybe there's a pilot neighborhood or something like that. So they said that over the next month or so they'll put some information together to see what kind of things that they might be able to offer us, which is great. Animal control. 1,807 dogs were licensed this year in town. Let's see, of that, Paul Morrissey, our animal control officer, responded to 216 calls. Mostly, I think, dogs, some stray animals, injured animals. He did 14 quarantine orders of dogs, which either because an animal was bitten or an animal bit a human. And we have 369 livestock animals that have been inspected this year, which is cool. With our tobacco coalition, let's see, we went through 85 free inspections as part of the coalition. I know that we've dealt with tobacco a lot over the last couple of years. There was 57 youth compliance checks. And obviously 1 revocation of a permit this year. Let's see. Social media, we have over 14,000 Facebook followers on our main Facebook page. And on our secondary East Long Meadow Waste Reduction page, we have 12,000 followers. We had, let's see, 3 COVID-19 clinics, 3 flu clinics, and 2 joint COVID and influenza clinics. And we distributed over 3,000 COVID tests, which is awesome. And let's see, for the mosquito program, we had, let's see, West Nile virus and EEE positive mosquitoes detected in town. But because of our surveillance efforts, education, outreach, and population control, we have no human cases this year, or last year. So hopefully there will be none for this year. And that's our report. Eventually, you'll be able to come to town hall and pick up a copy of it when they'll bind it all up for all the departments, which is really kind of interesting to read. Okay. Any questions on that? Nope. All right. So then let's see, lastly on that list, we've got the budget request highlights. Our FY25 budget doesn't really look too much different than other years. For most of the items, we're not really requesting a big change in anything. I think the biggest change in our budget is the fact that this year there was two-step increases basically for employees, and one of them was sort of retroactive increase, and then there'll be with their contract there'll be another increase coming up this year. So there is a 9% increase in our line item for salary, but that kind of just reflects that and the fact that we've got Chris now. And I am actually requesting an increase in the ACO stipend because we still only have one ACO. Our backup has been our main for almost a year now. And I think that it's just not very competitive. We get a lot of like Indeed resumes that clearly are just people trying to put in a job and Indeed just to say that they're still looking. So hopefully that if they do approve that, we might be able to get somebody more competitive. And so our proposed operating budget for the health department will be $345,643. And let's see, for our trash budget, basically per the agreements in our contract with Casella for both our disposal and for the hauling, it's a 5% increase, and that is $1,588.89. And most of that is really just part of the increase in every year. Our the disposal amounts per pound go or per ton go up. So it will be, how much is it this next year? $103 a ton. So we have to continue to keep recycling because the recycling fee is a lot cheaper than that. We do get like rebates back for recycling. That comes out to more like, it's $56 a ton. So it's significantly less for us to recycle than for us to make trash. Any questions on that? It's I know it's dry, it's just numbers. No? Well, that's all I had of business at hand. For other business, I went to the Pioneer Valley Tobacco Coalition meeting, was it 2 weeks ago? And one of the things that Cheryl Spara, the attorney, I think she's come to some of our meetings, that she brought up, she went over some highlights of new updates to the model code, which is what we use to adopt for our code. And some of the stuff I think may have that they're putting in the model for people to adopt, I think might have to do with some of our meetings because they're going to put in more language on actually defining what is a real value purchase a sale for value in the model code, which I think would be really helpful among other definitions that they're doing. So once that comes out, I think it would be a good time to see what they have in there, kind of to avoid some of the scenarios that we've been in. But maybe she said maybe another month or so, and once those are out, I'll send everybody a copy just to kind of get an idea if it looks like it's something worth doing this year or waiting another year to do. It would, similar thing, we'd put it in the paper for 14 days and have a hearing to discuss it, public hearing to discuss it. Other than that, I think that's kind of almost everything we're up to. We are thinking about doing like a Medical Reserve Corps and a CERT team kind of meet and greet with the volunteers. We're going to do that sometime soon. I'd like to have somebody from MEMA come because I feel like I'm not that CERT sophisticated. I've got the MRC side done, but not the CERT. And we're doing, we're gonna start planning the second round of trainings, which this one will be, the first one was more like basic life-saving skills, and the second one will be Heart Saver First Aid CPR. And anybody who's been in the health department knows my office is full of mannequins. Let's put them to work. Let's see, anything else?
Is there any talk about, I know I had brought this up to you, I'm just thinking about the AEDs at the practice fields. And if there's any grants that come through that maybe we could potentially think about, maybe getting one for the spaces where they're not attached to a school. I know we have to get like a special box or whatever, but I'm just thinking about, there's been so many children that and I know I brought this to your attention too.
Yep.
But I just think in terms of like looking for opportunities for the health department to look into for grants from a public health standpoint and also from a risk reduction with children. I mean, that's the one thing that can save their lives. So I think that would be just maybe something for us to think about for the year ahead for opportunities. I don't know, Christine or, Rebecca, do you have any thoughts about that?
Oh, I think that's a great opportunity to look into for sure. Not just the kids, right? But anybody. And to go along with that, I know some other communities are looking and have received grants to put Narcan in some of their public buildings, like the health department, the library, the senior center, and even some local businesses have stepped up and done that. So that would be another option that I think would be a really cool opportunity for, obviously there's some political debate about that, but on a public health standpoint, there is no argument whatsoever that we should be looking at doing that. potentially as a grant as well, in some of our public buildings.
Yeah,
Yeah.
the grant is facilitated by the police department in our town. And so I've been trying to get on the community so that we can maybe start talking about putting the locks boxes in the buildings. I did talk to both the school department and Park and Rec about the AEDs, and I don't believe either of them are going to pursue putting in permanent stations because of how it's not cost effective and it's not helpful. Like there's nobody kind of maintaining them at the parks. But I have also directed some of our teams to Kev's, where the grant where people can purchase them.
Yeah, it's a great organization.
Yeah. And I know that while they're not, Parks and Rec isn't requiring teams to have who utilize the fields to have them. I know they've been kind of in talk with people about how they could acquire them. Yeah, I think
I wonder what other towns do.
I don't
Just
think they do
because, I
anything.
mean, like, well, we should.
I know.
Sorry.
the thing.
That's like the doctor in me being like, it saves lives all the time. And that's an easy thing to have, and they're like idiot proof. Like, it's the easiest thing to attach. Like, if there's direction with pictures, you don't even have to read.
Yeah, we have 3 in my school because it's such a large school. And we had it was because of a situation when I was a school nurse there years ago, for a student, and there was only 1. And after that situation, 3 were put in. We also have them available for the trainers. So when the trainers go to games, they go with the trainer for the sports because they have been used and they are effective. Also, Narcan is in the high schools and the middle schools in Springfield, and it has been for years. I haven't been the school nurse there in 8 years, but it was implemented when I was there. So they are effective. The school nurses maintain them. They do monthly checks, the batteries, all of that, things that are changed. They run through it, and there's a protocol for it. But definitely people can learn, use them, and it is very simple. Take them out of the foil packaging, place them. There's also the adult, but also the pediatric. They have pediatric versions and pads. Obviously, in our school, we have 9 through 12, so we have adult ones. But we do have available because we do have a preschool. So we have, 3 and 4 year olds. So I echo what you're saying. Yeah.
I mean, it'd be kind of great if East Long Meadow was like the gold star of how to do this the right way instead of like, no one else is doing it. It's something, especially with knowing that our previous principal of the middle school almost died from an out of field arrest. And I think when I think about all the children you hear about in the stories, there's probably at a 0 or 2 zeros after it of that, the stories across the country where children or people who are at children's events are having events happen. So, but
the difference I think between the different types of sports in town also, so the school related sports, I think only at the high school and the middle school level they do require, so there are AEDs at those events, but all of our little peewee leagues, things like that, because they're either private leagues or run out of other organizations. That's I think the area that
they're all through the rec department.
Yeah.
And so even they all have to rent the fields from the rec department. So as least as far as I understand it. But just thinking about if we could, have access to an external one at some of the again, I'm sorry, I'm going a soapbox, but I just think it's something we should potentially at some point look into a grant if there is one that exists for us as a health department to talk about, or also, like you said, direct those people who are interested in the community, who are the people who are on, say, the soccer board or the baseball board or, softball board, whatever it is, if they wanted to pursue grants from those individual levels, I just want to make sure we have enough support for them if they want to have that for their institutional kind of organizations as well.
It seems like there's like on the Park and Rec board, there should be like a champion for pushing that. Something like,
Yeah, absolutely.
if you're going to use a, if you're going to fill out a park use form, part of it, on the checklist, obviously like that's, sort of like institutional kind of thing to get done there, but
Well, in the rec
And-
department uses the indoor facilities, not just at the high school and the middle school. They practice in the elementary schools, right? They practice in other facilities. So, um, including all of those in the same process, right? Because the same thing, like it's one thing to have it with the trainer of a high school game, but if you're at basketball practice at one of the elementary schools, it's a different.
and
But they should be in the school.
they
And
are.
They
you
have one.
open them and take it out. Yeah.
And then
But I guess the question is, are they accessible, right? Like, is it in the locked nurse's office
They
and
not
they're
be
having practice at?
They should be locked. I know at Putnam, they're throughout the building and they're never locked. They should not be locked so that people can access them. We have them in the entrance next to the
Mhm.
cafeteria and strategically all over. So they were never locked. We never had them locked in the nurse office. I don't know about East Long Meadow, but that was the whole reason, so that anybody could access them, especially after school. Either coaches, trainers, or whomever could access them easily. Yeah. Yeah, those should not be, in my opinion. And at my
Oh, no,
school,
I agree with you. We at the college, ours aren't locked. They're everywhere.
No,
right?
yeah, the schools, when I worked in town, none of the trainers are not trainers, but none of the AEDs are locked. Some of
Right.
them might alarm when you open them, and all those nurses keep a log. And actually, I started that at the senior center with the AED there. I keep a log and I check it every time I go. And they have the adult pad and the little
EVP.
children's. But the Narcan, they do lock up the Narcan, and it is in the nurse's office. So I don't know if that's something that a trainer can carry if they needed it.
That I
know.
Anyone in Massachusetts can carry Narcan. And Massachusetts has decided that putting the card in with the Narcan about how to use the Narcan
Mhm.
meets the criteria for training.
Really?
Because the Nalox boxes, I know that they have them in East Hampton and another
Mhm.
number of other communities. You don't have to go through training to access it. So
Okay.
yeah.
Often
makes
it's
sense.
prescribed at the same time. Like, so when someone gets like a post-op prescription for any meds now, I give them a Narcan script.
Okay, good to know.
So, and I think too, I mean, again, I would love it if it was just readily available for everyone to have on their person, just because again, it saves, talk about prevention of death, like that saves lives.
Yeah. Mm.
I'd like to get a naloxone training along with the other trainings that we've been doing. I think that, obviously basic life-saving skills, that would be great to have. So we do have half a dozen AED trainers. So if need be, we could always do little, mini pop-up training, AED, hands only CPR, that sort of thing. We've got plenty of those too. Yeah, I like that idea.
And just out of curiosity, the Narcan that you guys says, is it just a nasal spray?
That's what we have. Like,
That's
and
what we have
that's
too.
That's what's in the Nalox boxes is just the nasal spray.
The nasal spray.
That's-
It's like literally doing your Flonase spray. That's all you do.
too, and the nurse is locked up. They have the nasal as well.
Katie, you
Katie.
seen a lot of flu?
Oh, you caught me. I was just gonna say,
Well, we were
respiratory.
seeing-
so much flu this week.
Yeah, it's all respiratory cred, and those who are vaccinated are having less symptoms. Those who are elderly and then unvaccinated are having obviously worse symptoms. There was a bunch of COVID a bunch of RSV still, unfortunately, but those are tapering. I mean, they're not gone, but they're tapering off and kind of plateauing. But yeah, flu, a bunch. So, and then all the other crud, like everything in between, the stomach, adeno. If you have conjunctivitis, it's likely adenovirus. So, seeing a ton of people who have like GI upset and then like pink eye.
Huh.
Right. It's like, sure, why not have many areas of your body affected?
Those are like my two worst. But yeah, where everybody,
And
all the
it's a-
college kids are sick and so many cases of actual flu.
Yeah. And so I think the big thing, same thing, like hand hygiene, if you're sick, stay home, wear a mask. I mean, we're masking at Bay State, all employees as soon as we walk on the door. We're still in like that higher tier for risk for spread of respiratory pathogens. And so all of us are just taking enhanced precautions. Like when I go into any doctor's office now, I immediately put on a mask just because I'm afraid I might expose someone to something I didn't know I had. And I think, we're seeing it with all the children and from preschool to college, just because of the amount of people they're exposed to. So, yeah. All right, ladies, do we have anything else? I think we did it all.
Honestly, before the meeting started, I was like, I don't really have that much to talk about.
Well, you
And
made it last
we're-
an hour, Tammy.
Yeah.
we're 53 minutes in, and I'm like, maybe I had more than I thought.
Yeah.
It didn't feel as like exciting, voting and revoking.
We could use
Well, you
some
caught us up.
non-excitement.
Yes, you caught us up on everything. So now we're all aware.
Yeah.
Well, the person who does the Zoom invitations, I think he just went and he took our last month's one and he like copied and pasted the information. So everybody that came to our last month who was a panelist got an invitation. And so the Lisa from the state and Sarah were like, are we coming to a board meeting this week? And I'm like, oh no, I didn't realize. Like, no, we are not. That is not a topic on our agenda for once since June, which is nice. But it
All
will be
right.
back on another. Like I said, I think once the new updates come out, we should take a look at that. And there's some other things I know. Oh well, it'll be for next year. Like fees. We feel like we probably should institute a fee for people who don't want to go online and easily put in their permits. Just because we have this easy opportunity for them, and to take our employees' time away. I think that should be an additional fee for.
But there is
Unless
a
you
fee
have
if
an
you go
ADA
online.
exemption. What?
So there is a fee online though.
There's not a
Like when
fee.
I paid if you use a credit card to pay for anything on the website, there's a fee.
That's a transaction fee. But
Okay.
no,
I thought it was like.
so if somebody comes in and Renee's there at the front desk and they're like, I absolutely don't want to use the computer. I think that next season, I think we should have a fee for that, for her having to input it into the computer. It's so easy to do that.
But if someone doesn't have, we also should be cognizant someone financially might not have a smartphone or a computer. So I think about some of our elderly patients, not patients, elderly community members.
Yeah. So that's different. So like for the dog licenses and things like that, absolutely. But these are businesses.
Oh, but for business, sorry, yeah, I was thinking about.
I was
thinking about,
Katie, I was
don't do
gonna
that.
echo you. I was gonna say
Yeah.
like I'm totally in support of that for like the businesses, but for
Oh, absolutely.
individuals, like
Oh, I thought you meant
finally-
across the board. I was.
Oh
like,
no, not across. No, I meant for you guys to be voting on it on a new fee.
Okay.
For the health department, because at this point, if you can't, I don't know how you have a business if you can't function online.
Totally different.
Yeah. I mean, there are ADA requirements. So if you do, you might need an ADA accommodation because you can't use online products. Maybe you're blind. I don't know. You run a business. Then obviously I think we would make the exception for that.
Mhm.
But I'm just trying to think of like
I-
other things been talking about.
I have another meeting at 7. Can we pick a date for our next meeting? Sorry, I don't want to cut you off, Tammy.
No. We want to put one on for February, or do we want to move into
This is
the-
We're in
February.
February. It is February.
I'm sorry, March. I meant March. I'm sorry.
Do you want to do like the end of March? Because
Yes.
it sounds like we don't have a lot going on right now. Do you want to do like the week of the 25th sometime?
I will be at the preparedness summit. That
Oh,
week.
how long is that for? That's great.
The Monday through Thursday that week.
Oh, nice. Okay. And Easter is that weekend, so
Oh yeah. We could put the like the 20th or the 21st on the books.
I
That
can't do either of those days.
Oh. Or the 19th.
I can do the 19th.
I can do the 19th.
Okay, that works.
Okay,
Okay.
perfect.
All right. So to
All
get
right,
Katie
ladies.
out of here, can we get a motion to adjourn the meeting?
I motion to adjourn.
I
All right,
second.
Great. Christine Johnston, aye. Katie Dobbins,
Aye.
Rebecca Torsia.
Aye.
All right, a meeting is adjourned. So everyone have a great evening. See you
Take
in
care,
March.
everybody.
Thank you.
All right, bye.
Bye.